As I said, I have an implanted cardiac device. That's great. It's doing really good stuff. It's monitoring me, it's informing my healthcare providers, it's keeping me well. It was implanted with minimal pain, very, very light surgery. It has a long battery life. It's great, but I don't really know what data it's collecting. I know it's collecting my heart rhythm, but I don't know the fullness of that story. I don't know where it's sending it. I don't know when it's sending it. I don't know what's being done with it. I don't know to what further use it's being put. And I'm just the dumb node. My heart generates the data. It goes somewhere. Ultimately, I benefit from it, but I'm not able to see it myself, and I'm not able to supplement it with information about, for example, what's going on in my life, whether I've traveled, whether I've slept, whether I've eaten. I'm not able to do any of that because I'm just a dumb node in the story. Why am I a dumb node? Now, it could be, we could say it's because the doctors and the healthcare system don't know that I could add more. I think that's nonsense. I think people know very well. We could say it's because they don't care. I also don't think that's right, because I know they care. I think it's because people, the doctors and the healthcare system, are still frightened. They're frightened about what exactly is the legal and regulatory framework that this would happen in. What would happen if I add dirty data, if I add data that they have no control over? What would that mean? What could that imply liability? And it's that lack of knowledge which is, I think, impeding us from going as far as we could do with using and reusing the data that my device is collecting. I think what we need to do is a lot of the work that is being done by the Institute. We need to have good standard operating procedures. We need to have education. We need to have legal frameworks. We need to make sure that everybody in the story, from the patient through to the doctor, the nurse, the insurer, everybody really understands the potential and knows how to make the most of it. Because if everybody knows how to make the most of it, we could solve what I think are the 5 big E's of reuse of data. We could reuse data to engage the patient, to engage me in my own care. We could empower the patient to be more active in their own care. We could educate both the patient and the healthcare system. We can constantly evaluate, and through evaluation, we can evolve. And as the healthcare system evolves, we will provide better care to the patient. And so we would create a positive flow and a positive circle. I would really commend the work of the Institute, and to just say it is high time that we made a reality of reuse of data. The key vehicle for that is the patient, and the fuel is the data, and the ignition to start the vehicle is the interoperability and the legal frameworks which will allow us to do what we could already do safely and with full knowledge that we're doing the right thing.